Microspheres are formed when corticosteroid microcrystals are embedded in the PLGA matrix. Microspheres are designed to deliver corticosteroids within the joint over an extended time. Upon contact with fluid, corticosteroids start to dissolve and release from the surface of the microsphere as nanochannels begin to form. Initial drug levels in the synovial fluid result from corticosteroids released from the microsphere surface and, more gradually, from deeper within the microsphere core through the nanochannels that form throughout the microsphere. After release into the synovial fluid, the dissolved corticosteroids diffuse throughout the synovium and are cleared to the circulatory system, while the microspheres themselves localize to the synovial tissue and away from the articular surface as they continue to release drug.
Indication and important safety information. Indication: Zilretta, triamcinolone acetonide extended-release injectable suspension, is indicated as an intra-articular injection for the management of osteoarthritis pain of the knee. Limitation of use: the efficacy and safety of repeat administration of Zilretta have not been demonstrated. Contraindication: Zilretta is contraindicated in patients who are hypersensitive to triamcinolone acetonide, corticosteroids, or any components of the product. Warnings and precautions: intra-articular use only. Zilretta has not been evaluated and should not be administered by epidural, intrathecal, intravenous, intraocular, intramuscular, intradermal, or subcutaneous routes. Serious events have been reported with epidural and intrathecal administration of corticosteroids, and none are approved for this use. Zilretta should not be considered safe for epidural or intrathecal administration. Hypersensitivity reactions: rare instances of anaphylaxis, including serious cases, have occurred in patients with hypersensitivity to corticosteroids. Joint infection and damage: a marked increase in pain accompanied by local swelling, restriction of joint motion, fever, and malaise are suggestive of septic arthritis. Examine joint fluid to exclude a septic process. If diagnosis is confirmed, institute appropriate antimicrobial therapy. Avoid injecting corticosteroids into a previously infected or unstable joint. Intra-articular administration may result in damage to joint tissues. Increased risk of infections: infection with any pathogen in any location of the body may be associated with corticosteroid use. Corticosteroids may increase the susceptibility to new infection and decrease resistance and the ability to localize infection. Alterations in endocrine function: corticosteroids can produce reversible hypothalamic pituitary adrenal axis suppression with potential for adrenal insufficiency after withdrawal of treatment, which may persist for months. In situations of stress during that period, institute corticosteroid replacement therapy. Cardiovascular and renal effects: corticosteroids can cause blood pressure elevation, salt and water retention, and increased potassium excretion. Monitor patients with congestive heart failure, hypertension, and renal insufficiency for edema, weight gain, and electrolyte imbalance. Dietary salt restriction and potassium supplementation may be needed. Increased intraocular pressure: corticosteroid use may be associated with increased intraocular pressure. Monitor patients with elevated intraocular pressure for potential treatment adjustment. Gastrointestinal perforation: corticosteroid administration may increase risk of gastrointestinal perforation in patients with certain GI disorders and fresh intestinal anastomoses. Avoid corticosteroids in these patients. Alterations in bone density: corticosteroids decrease bone formation and increase bone resorption. Special consideration should be given to patients with or at increased risk of osteoporosis prior to treatment. Behavior and mood disturbances: corticosteroids may cause adverse psychiatric reactions. Prior to treatment, special consideration should be given to patients with previous or current emotional instability or psychiatric illness. Advise patients to immediately report any behavior or mood disturbances. Adverse reactions: the most commonly reported adverse reactions, incidence greater than or equal to 1% in clinical studies, included sinusitis, cough, and contusions. Please see full prescribing information at zilrettalabel.com. To report suspected adverse reactions, contact Flexion Therapeutics at 1-844-FLEXION, 353-9466 or FDA at 1-800-FDA-1088, 332-1088, or www.fda.gov/MedWatch. Zilretta is manufactured by Flexion Therapeutics, a specialty pharmaceutical company focused on the development and commercialization of novel, local therapies for the treatment of patients with musculoskeletal conditions.